Good mind. Perfect. Right on cue. So we're recording this evening. Just feel free to hop off if you're not comfortable with that. If you have any questions, please put them in the chat and feel free to private message me or Betsy Better on the call if you have questions at any point, or you can just throw them in there and we will get to them as we can at the end of the panel. So kicking us off today, we are here to talk about preemption or local control, an issue that is going to be, has been all over the country this year and previous years, but really, we've really seen it this year. So we're going to kick off today by talking about a story that happened in Ohio earlier this year. And for that, I'm going to do a little intro for Dustin Hoffinger, who is our Director of State Government Relations here at the American Heart Association, where he is dedicated to Ohio statewide and local health initiatives. He practices policy leadership, focusing on addressing top health priorities in the state, including but not limited to water access, telehealth access for all Ohioans, state funding for important health initiatives, regulation of e-cigarettes and tobacco, healthy food access, complete streets, and so much more. So he's going to give us a little story and some background on some events that happened in Ohio earlier this year. Before we do that, we're going to show you a quick little video that's going to talk about exactly what we're doing here tonight and kind of level set for us all tonight. So just pause for a second. We'll get the video pulled up. And just a moment so we can get that loaded.
Watch out. Big Tobacco is sneaky. Ever wonder why they seem to support legislation that claims it will prevent young people from using their products? Yet trusted health organizations like the American Heart Association oppose some of these efforts. Big Tobacco lobbyists often add tricky language, like the fine print of a bad deal, that can harm more than help. That's why public health experts speak out in opposition. Bad bill language takes power away from local authorities. This can make it harder to pass any new tobacco laws. Their attempts can even overturn policies that many communities and schools have already implemented. This is important to protect our children from dangerous tobacco products, including e-cigarettes and other vape devices. That's exactly what is happening right now in our state. Let's stand together against Big Tobacco and tell them our community, our health, our voice. Learn more by texting community to 46839.
Awesome. Thanks for sharing that, Cami. So with that, I'm going to turn it over to Dustin, who's going to talk about kind of what happened in Ohio.
Hi, Jacob. Thanks, everybody, for having me this evening. I really appreciate it. I'm Dustin Holfinger here in Springfield, Ohio, just outside of Columbus. At the end of 2022, we were successful after months and months of public hearings, testimony from both sides, drafting and redrafting of language, successful in getting the Columbus City Council to enact a flavor ban on all tobacco products, including menthol cigarettes and e-cigarettes. At that time, we had called on all of our volunteers to send emails and support this proposal, and we had a unanimous decision in council on December 12th, I'm sorry. And then on December 13, you'll see why this date sticks out in my mind forever. Literally the next day, the state Senate introduced an amendment to a very innocuous bill that would have preempted, an amendment that would have preempted that entire proposal. But it really didn't narrowly preempt that language specifically. It preempted everything in the state of Ohio, meaning no political subdivision in the state was able to pass their own tobacco control policy. This would have been devastating for the state of Ohio and rolled tobacco control efforts back by at least decades. This would have preempted any local school districts from passing any external or exterior smoke-free policies for their campuses or their football stadiums. It also would have preempted park districts from passing their own smoke-free policies there in the parks. So it was a very, very big deal and very damaging, potentially very damaging. Unfortunately, that rolled through the Senate literally that night on the 13th, went to the House the next day for concurrence. The House, unfortunately, after everybody we talked to literally looked at us in the face and said, "I'm sorry. There's nothing I can do. My hands are tied. I have to vote for this." That's how some things work sometimes, unfortunately. So we know we have quite a few legislators on our side, even though their vote didn't say so. But we believe that we really got to them really good. So as we transitioned from a flavor ban coalition, we transitioned to a preemption or defense coalition. And we added about 30 or 40 groups ranging from public health organizations, Mayor's Alliance, Children's Alliance, mayors of cities, the Breathing Association, all down to really just kind of finding a way to defend against this preemption. And we literally grew that coalition from 6 organizations to 40 in 1.5 days. And on December 14th, that's when we created that coalition, called on all those partners to call on their legislators, call on the governor to veto this legislation. Luckily for us, it was at the end of a General Assembly. So Ohio runs off of 2-year cycles. We have a General Assembly that just started in January. But at the end of this last one, the 134th, that's when this bill passed. So it passed the legislature. Then they send it to the governor for him to decide the bill's fate, sign it, and it goes into effect, or veto it, and it's vetoed. Luckily for us, the legislature decided to adjourn sine die on December 29th. Well, that was still within that time frame of the governor. He has 10 days to sign to decide the fate of the bill. That was still within that 10 days. So we really hit it hard. We had every single member of our coalition, all of our volunteers, sending emails, making phone calls. I think overall, our state lawmakers received over 1,500 emails apiece. The governor in that 3-day period received 90 phone calls and received over 800 emails alone. So we really tried to hit them hard, hit them fast, let them know the negative implications of this type of legislation and how Ohio will not stand for this. We are a home rule state. So the erosion of home rule in the state of Ohio is not only important for the tobacco policies, but as you can see by our coalition and how we were able to grow that organically in 2 days, we really saw the importance, or people really saw the importance of protecting that home rule status here in the state of Ohio. So ultimately, the governor did veto this legislation on January 5th. It was quite the New Year's treat for us. He hosted a press conference where he discussed the importance of public health and preserving the ability of communities to enact their own laws to protect their citizens from big tobacco. That timeline preserved the veto and protected it from an override from the legislature, because that General Assembly was gone already. They couldn't call them back in for a veto override. And then at the time, Governor DeWine expressed his interest in a potential statewide flavor ban. As you can probably tell from our legislature, with their ideas to preempt that legislation, we're concerned that could not happen here in the state. But it does allow, again, all the communities that were interested in moving forward with tobacco control policies, the ability to do so. And literally on January 6th, our emails and our phones were blowing up with local communities looking to continue their work on tobacco retail licensure, or even in some cases, an interest in moving forward with a potential flavor ban ordinance. So we were very, very pleased with the turnout from our volunteers, pleased with the turnout from the coalition. We really believe that is what moved the needle on this approach. And again, thank you for the governor. Now we have him on our side. If there's another preemption amendment put forward, we'll call on him again and we'll see what we can get done. So that's what happened in Ohio. It was a pretty scary period there for about 3 or 4 days. And then ultimately we were able to start 2023 with a breath of fresh air, literally.
And Dustin, how many, because we've been working at AHA and all of our coalition partners and stuff, have been working on like local policy in Ohio forever.
Yeah.
Right.
Yeah.
And this bill was going to actually remove all of that, right?
Yep. Yeah, it would have made all of those policies that we had worked on in Cincinnati had a very robust tobacco retail license. Columbus already had a tobacco retail license. All the smaller communities across the state had enacted that to make sure that their retailers were held accountable, which is what their community wanted. Not every community wants to do that or feels the need to do that, but those that do should have the ability to do so. And that's what we were able to protect, is their ability to enact their own regulations.
That's awesome. Well, thank you for jumping on and for congratulations.
Thank you.
For doing all of
Appreciate
that. I'm gonna introduce our panel now, who's gonna kind of talk about, similarly to what Dustin was talking about, but has been working in this space and volunteering in this space for years. So first off, I'm going to introduce Christine Compton, who is a member of our AHA team. She's a public health professional with passion to improve outcomes and disease disparities by creating progressive measures, programs, and policies to accomplish this goal. Christine, I'm so sorry, is a national senior advocacy consultant for the American Heart Association's Voices for Healthy Kids team. She works on campaigns across the country, strategizing about policies that support the mission of the organization with a focus on equity and empowerment. I can't read today, y'all. So I'm also going to introduce Annette Fede Santilli. I want to make sure I'm pronouncing your last name correctly. I'm sorry if I didn't. Annette received her BS, or Bachelor's of Science, from West Virginia Wesleyan College, and received her Master's of Arts from the West Virginia University. She currently works for WVU Research Corporation with the WVU School of Public Health. She is a committed advocate for the Heart Association and a number of other organizations. She received an alumni award for community service in 2019 and the National Community Advocate Award from the Pancreatic Cancer Network in 2015. And that's fight for healthy communities comes from their impact on her personally. She lost both her dad and father-in-law to heart disease, but her dad lived to 81 because of the advances made by the American Heart Association. And she strives for healthier lives for all of West Virginia. So Annette, thank you so much for joining us tonight. And last and certainly not least, I'm going to introduce DJ Yearwood, 16-year-old from Kansas City, Missouri. DJ has got involved with the American Heart Association in a flavored tobacco restriction campaign in 2020. After that, he has spoken on numerous different panels at the national level, press conference with Governor Parsons in Missouri on behalf representing the American Heart Association. Just this last year, he was in the legislature yesterday, ready to testify on this issue. And besides working on tobacco cessation and different tobacco programs in Missouri, he is extremely active in his community with other organizations and volunteering for numerous organizations in the area. So I just get to join and ask these wonderful people some amazing questions. So if you have any questions, please put them in the chat, private message myself or Betsy, and we can get those answered. So I'm going to start, Christine, I'm going to start with you. So knowing what happened in Ohio, what should other states be looking out for and, be paying attention to?
Well, there's a lot. But basically, our national partners are helping us track about 600 abusive preemption bills across the country just this legislative session. And we here at AHA are specifically tracking multiple harmful preemption bills, mostly in the areas of public health and tobacco. But several also are just touching broad preemption that would severely restrict local government authority, similar to what Dustin talked about in the bill that came before Ohio a few months ago. These bills can be triggered at the state level when localities attempt to create regulations on public health and related issues, again, much like the story Dustin just shared with us. So really, you need to be on the lookout for language that talks about restrictions to political subdivisions, changes to regulatory authority, and limitations on municipal ordinances. And part of what we are doing here to help combat that We are looking at several different messaging testing projects, including a new guide from Voices for Healthy Kids that will be available next week.
Awesome. Yeah, I appreciate that. Nat, I'm going to go to you. Why is it so important for advocates to be involved? Why is it important to go and share your stories on these type of issues?
Well, we are their constituents. We elect them and they represent us. And we need to just keep behind that and let them know what we want, because chances are we're going to be the people that are down there, and not wait till the last minute. I was thinking when we were talking earlier today, there are some kids at North Marion High School who are going to be new advocates, because their teacher was teaching yesterday, and I don't even know the class, but their teacher was in the middle of a lesson and he dropped dead of a heart attack while in the classroom yesterday. That happened. So I thought to myself, these are kids that are going to be able and willing and will probably serve as great youth advocates. I'm sorry to say, the circumstances, but they indeed will.
Wow, I hope the teacher's okay. But yeah, I think that just highlights that it can happen at any point in time, anywhere, and anyone, right? Heart disease is not limited to a certain group or certain demographic or certain location of any sort. It really does matter. And back to your point about like being constituents, right? Like lawmakers value and need to hear from their constituents, people that they represent. So along that, DJ, you were there to kind of talk to the Missouri legislature yesterday on a bill around this. What do you think other advocates, other people that like aren't getting involved or aren't involved yet, that they need to know specifically to help, fight these policies that are going to undermine local decisions?
Yeah, I think that one thing that helps to keep in mind is that they don't know your perspective unless you tell them. Yesterday was a good example of it. So there was a preemption bill in the Missouri House that was a straight up preemption bill on all tobacco policy at any political subdivision level. And so basically getting an understanding from all of the committee members and the sponsor on what the purpose of the bill was and how it will impact the political subdivisions and the communities therein was an important part. And come to find out that the sponsor was trying to do something completely different than what his bill did. And so we were able to communicate, what our goal was, or what our goal was, and then what this bill would do and how it would combat multiple things and impact multiple communities, like the youth in the area, tobacco licensure laws. So Missouri is a state that has 0 state tobacco licensure laws, and all tobacco regulations lie at the municipal level. So this is something, this is a situation of one of those, it's going to happen unless you say something. So.
Yeah, and it's wild to me that the introducer and the sponsor of the legislation didn't know what it was.
Right.
Right.
I'm not 100% sure, but I'm pretty sure he literally said that he didn't know that. So, yeah.
Well, and it just shows why being involved in this process, why you going to the Capitol, why calling them, why being engaged in this matters so much, because there's so much happening in every state legislature that sometimes these things are either purposely introduced, right, and are intentionally trying to do this, like in Ohio, the story Dustin shared, and sometimes tobacco corporations are able to get it introduced without maybe the sponsor even knowing what they're doing. So it's just that much more important for all of us to be engaged, and for people who care to speak up and let their lawmakers know. So if there are any questions, please put them in the chat. Let me know. I did get one question, and you know what? I'm gonna open it up for anyone here, I think I have one answer that I know about, but has any state tried to, have they lost local control at any point? Has the state preempted any sort of local community before and that they've given those rights back? Or has that, like, are we working on that?
Jacob, I think Colorado did. They had preemption for a long time, so it wasn't easy, but I believe they were able to undo it after it was in place for a number of years.
Awesome. Thank you, Grace.
Yeah, I think there are a couple states that are trying to work on that, but we haven't seen much success yet, but I know there are some states looking at it.
I know that on various other topics outside of AHA, AHA surroundings, that Missouri has preempted localities quite a bit on multiple issues. And I think when it comes to whether or not they get it back, as far as I know, no.
So far.
Yeah, so far. So
Well, we do know it's very hard to get that back once it is in law, right? It's really hard to undo something and ring the bell, as they say. But I know that based on certain issues, states like Missouri, New Mexico, I know are looking at repealing a portion of preemption that is on the books.
Yeah, that's awesome.
Jacob, it's Betsy. Good evening, everyone. This is Betsy Vetter. I live in North Carolina, and I will say that in North Carolina, we passed what we affectionately here called the Dirty Air Law, which was in 1993, which was a bill that took away local control, especially over smoke-free policy, taxation policies. When we went after our smoke-free law in the 2000s, one of the things we did was chip away at preemption. So we have restored some local control in North Carolina. We started in a very methodical way going after like local control as it related to local governments and their authority over their own property, local government property, school property, the university system, the state motor fleet. Places like that where people may not realize that they weren't able to do. And so we would work with those agencies, get them on board and restore local control that way. And then when we did pass our smoke-free law, we restored local control around public places. Not every public place, but it's written in a very specific way, but it did restore a big chunk of local control for smoke-free policy. So we have done it. Grace is right. We did it in Colorado. Grace is actually working on some of that in Hawaii. So, it just is a lot of work, and it was very time consuming to do that chipping away approach. So
maybe
but all things can change with good advocacy.
100%.
Well, I say, Jacob, if there's a moment, I'll share a little bit what's happening in Hawaii if people want to hear. So yes, Betsy's
Grace, you're good.
okay. Betsy's right. So, and I will say this is an example of how I take this very personally still. It was in 2018, how devious it can be. In Hawaii, they added it onto a bill around kidney dialysis. And so they preempted tobacco at the local level by tacking it onto a bill that would build more dialysis centers, which, as you imagine, a state that is remote like Hawaii, when they need it, they really need them. So we couldn't exactly go after a governor's veto knowing the implications. So it's been 5 years, and the counties initially were kind of like, well, fine, we'll see if the state does something. And they have not done anything really on the tobacco issues that they feel is making a difference in the vaping use amongst youth. So the counties are all in this session. So I don't want to jinx it, but we have made it further on repealing preemption than we've ever made it. We have one more committee before the floor vote. So fingers crossed for us.
Okay, let's go Hawaii.
Yes. And also watch out, they can be devious. They'll stick it on a dialysis bill. That still makes me so mad.
Just anywhere, right? That's insane. So All right, we have come to the end of our time. So I want to thank all of our speakers. I want to thank Christine, Annette, DJ, Dustin, for coming on tonight and talking with all of us. Thank you for everyone who kind of chimed in here and gave some more feedback and some more information on kind of what's happening around the country. Before we go, I'm going to ask DJ, what is there something that everyone can do today to kind of help us out?
Yeah, everyone can text PROTECT to 46839. Again, text PROTECT to 46839.
Awesome, and that'll help you get set up to help any of our local control campaigns that we have across the country. So awesome. Well, thank you everyone for your time this evening, and have a wonderful rest of your day.